Welcome to Frontline News, a weekly University of Maryland School of Medicine broadcast highlighting the faculty, staff, trainees, and students who are fighting COVID-19 on the front lines of research and clinical care. Coming up, how an advanced form of life support called ECMO is helping to save the lives of COVID patients. And we'll talk with Dean Reese about the importance of continuing frontline research during the pandemic. But first, Dr. Anthony Fauci had good news this week about the antiviral drug Remdesivir, which was tested right here at the University of Maryland School of Medicine by the Center for Vaccine Development and Global Health.
The data shows that Remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
Remdesivir is an antiviral drug. And so it was developed actually initially to help to treat Ebola during the Ebola pandemic. It turned out that it wasn't a good drug against Ebola, but in the laboratory, when you test Remdesivir against COVID virus, it has very good killing activity. And the way it works is that when the virus gets into human cells, it clones itself, it replicates. And this Remdesivir interrupts that process and does not allow the virus to replicate itself. It's an intravenous drug, and so it's given to people who are hospitalized with COVID. And the design of the trial is to randomize. So by chance, some people get Remdesivir and an equal number will get placebo. And in this case, we had to work with very sick people. And so the way the Remdesivir trial worked is that when patients who were hospitalized in the biocontainment unit, in the ICUs, at UMMC, we had to be notified, and then we had to work very closely with healthcare workers who are extremely busy and under a great deal of stress. And so the CVD had a large team, and we found a way to work with the doctors and nurses to minimally interfere with what they're doing to save people's lives.
The Remdesivir trial is one of many research studies underway at the School of Medicine targeting COVID-19. I spoke with Dean Reese this week about the importance of continuing research during the pandemic.
First of all, Larry, I want to just say how much I thank our entire academic community for being on the front lines, whether that happens to be in clinical care or in research or in some regards education. Our faculty has been extraordinary during this time, and I very much appreciate this and want to affirm them in their efforts. Now, with regard to research, as you know, we are in a restricted research environment at this time. However, we have made some exemptions, and we have about 50 or 60 laboratories that are actually open right now. But they are primarily involved in doing COVID-19 related research. It is very important that even during this pandemic, that we still keep our research operation going, because many of our faculty are working on prevention, sometimes cures, whether it be therapeutics or vaccines, or trying to understand the biology. This is important. But there are other more sensitive or equally important research that is continuing that we have kept in place just the same. Very important that they coexist at the present time.
Last week, we took you into the hot zone at the R. Adams Cowley Shock Trauma Center, a special ICU where the most critically ill COVID-19 patients are being treated. Some of those patients need more respiratory support than a ventilator can provide. That's when the ECMO team steps in.
The way ECMO works is large catheters or cannulas are inserted into blood vessels in the body. The blood is removed from the body, goes to a pump, it's oxygenated and carbon dioxide is removed, and then it's pumped back to the patient.
It's very effective in treating the primary lung failure component of COVID pneumonia, as well as other types of pneumonia as well, but specifically here, where the lungs, sometimes we look at the x-rays and we're actually surprised that the x-rays don't look as bad as we might expect them to look as low as the oxygen levels in the patients are. And so ECMO really allows us to correct that problem very well. It doesn't repair the lungs and it doesn't fix the infection problem. But what it does do is it gives patients the time, it buys time for their own lungs to recover and for their body to fight off the infection and get better.
I can't emphasize the team enough. It's this disease has certainly been humbling, but it's being at the University of Maryland with such a diverse group of people and a dedicated group of people. I couldn't have asked for anything more. This last round when I was on call, I can't even remember the number of ECMOs I put on, and it was about as smooth as it could be compared to any other institution I've worked at, because we've got such a dedicated and skilled group of people that we're working with at all levels. So really proud to be here.
You can stay up to date by visiting the Coronavirus Update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.